Hey guys, quick note before the podcast. Hope you guys are having a great week. I just want to let you guys know that if you have any feedback, I'd really appreciate that. You guys get a hold of me on LinkedIn or my email. That's joe@codessa.io. That's I and the O at the end. Just let me know what your feedback is, what questions you want to hear, guests, all that good stuff. I'll keep giving you guys great content and hopefully keep this thing going. All right, have a great day, guys. Now to the podcast. Hey business family, welcome to another episode of Joe Momo Presents. I'm really excited to have a fellow U of A alumni, awesome businessman, Calgary businessman. He has a dentist practice, co-owner of Midtown Dental, 9th Avenue Dental, Amreesh Khanna. Welcome to the podcast.
Thank you, Joe. Yeah, it's great to be chatting with a fellow U of A alumni as well, and excited to know about what you're doing and really, getting to know some of the Calgary business community. And it's a pleasure to be on your podcast today, and thanks for having me.
Yeah, for sure. Well, let's get right into it. So tell us a little bit about your origin story, how you kind of came to be. I know you started your practice in 2012, but I'm sure, again, there's lots of golden nuggets in those years. So, yeah, I'd be really interested to hear from you.
Absolutely. So, born and raised Calgarian, parents migrated to Canada from India in the 70s. So I was born in the 80s here in Calgary, and went to school here, grew up here, and started kind of exploring. Obviously getting to high school and things, trying to figure out what do you want to do and where do you want to go moving forward. I had an interest in the health sciences always, and kind of explored the avenues of did I want to go into medicine or dentistry, and what did I want to do in that regard. For me, I was fortunate, had a bunch of family friends who were in both professions, so I was able to get some exposure and also shadowing time, things like that with them. And what really struck me as kind of my interest in where I wanted to go was dentistry, because of the autonomy it also afforded me to be able to take care of patients, but also have some control and autonomy over the life that I wanted to create for myself from a business perspective as well too. My dad, had a big influence on helping guide me to where I wanted to be. He was an engineer, and he'd been through lots of the ups and downs in the Alberta economy as well too. He's fortunately worked for the federal government here for Environment Canada for a long time, but he always told me, if you can find something that you can get into where, you're not going to be stuck to the economy to the same degree, that he had seen him and many of his colleagues. He's like, that way you're not tied to a lot of the market factors. So healthcare was, it's not that it's not affected, but to a lesser degree, of course, right?
Yeah.
So, everybody needs us in one way or another. So
Exactly.
At some point. So so that's when I embarked on my path of getting educated in that regard. So I did 2 years at University of Calgary here in biological sciences, then got into the University of Alberta in the dental school up there. So completed my dental degree and also got a Bachelor of Medical Sciences up there. And then through my dental program, that really kind of helped me explore, what aspects of dentistry, what am I doing that I really enjoyed as well too. And I found that I had a really keen interest in surgical procedures, sedation dentistry, and implant dentistry. And I saw that, I graduated in 2007 from there, and I saw that it was really a big part of the future of where dentistry was moving. And there was a huge need for it, because it was a procedure that at the time not a lot of generalists were doing. And generalists were getting educated to do so, but sometimes patients had a long wait to get into specialists to see them for those types of procedures and just get the access to the care that they wanted. So I went on and pursued some postgraduate education in something called a general practice residency out in New York at the Montefiore Medical Center, Albert Einstein College of Medicine. So I got to live in the good old Bronx for a year and experience the Big Apple.
Yeah.
And it was a pretty cool experience all around, both from a clinical learning perspective all the way to just a life experience. I mean, there is no place like New York, that's for sure. So to be able to enjoy, that time in my life and be able to, learn out there and live out there, it was a great time for sure. So I learned a lot. Came back to Calgary, through dental school too. One of my mentors, he always, told me if you had an interest in this type of thing, I thought about, do I want to specialize further, going into oral surgery, what do I want to do? But he said, if you can do a lot as a generalist too. That's the beauty of general practice, is you can kind of in a way almost subspecialize, find a niche that you're interested in, and be able to serve a large patient base doing so. So he said, Calgary's not saturated. See what you want to do. You can always come back and try that too. And family is a big important part of my life, and my family is all back here in Calgary as well too. So I came back 2008 and started practicing at that time. And then in 2012 is when bought our first practice. So my brother is also a dentist and followed a similar path as me too, also a U of A grad as well too. And then I'd met my wife as well too, who's also a dentist as well. So wow. She's a U of S grad. We like to joke around as to whose school and whose province is better, but I secretly say Alberta always is the way to go.
Yeah, I agree with you. No bias there.
Yeah. So the three of us embarked on that first kind of ownership journey together in 2012. Took over a practice from an existing dentist and started working together and running and managing the business together. And that started kind of our careers officially as entrepreneurs, I should say. And it was a lot to learn. We came from some experience because we'd all been working at different practices and kind of brought our collective experience together in our first business venture. And then 2013, unfortunately we got flooded. So that was a big learning opportunity I can tell you a little bit more about, as we go on through the podcast here. But it was it was a big challenge and a big thing that we had to take a lot from and learn about too. And then grew from there, have a second practice now. So our first practice was Midtown Dental. Second practice is called 9th Avenue Dental, which we bought in 2018, and which is right in the core. And so, again, lots of great things from that practice and lots of challenges too, because, it was a core practice, a lot of clientele that's based on, the economic factors of the oil and gas sector again. So, always finding ways to continue to grow and create value for our patients and so on. So, and then with the interest side of what, I was saying I learned through my programs and stuff, sedation dentistry became a big part of what we did. And in my early years of my career, I found that was a big area where patients had limited access to care. Not a lot of places would offer sedation dentistry or IV sedation dentistry, which is what I practice in, and to be able to give them, an option to be able to make their care and a lot easier, less painful, more comfortable. So, had colleagues who would be referring patients to me and say, hey, could you see this patient for me, that patient for me? So then me and my brother decided to formalize our referral part of our practice and called it Midtown Sedation. So within Midtown Dental, we also have a referral practice called Midtown Sedation. And
oh, cool.
Yeah, and so through there, we actually take referrals from other dentists all throughout the city for sedation procedures, surgical procedures, just to be able to kind of work as a partner in the care of patients from all over town.
Right.
So, yeah. So that's kind of where I'm from and where I'm going, and or where I've got to, I guess I should say. And also, a big part of my origin story where I am today is my family and my kids. So, 2 lovely little kids and 2 girls, and young little ones right now. So that's a big part of my life, 3 years old and 1 year old, and just looking to always make sure you enjoy those experiences and yeah.
Absolutely, yeah, no, for sure. Family is actually we're in Amreesh's home office right now, and there's some crying in the other rooms. So.
Yeah, exactly.
Talking about little ones.
Yeah, exactly.
That's funny. That's really awesome. I guess one thing when you're starting your career, or I guess where you are today, what one thing you wish you knew before you began your career, or when you began your career?
Yeah, I think. Going through a health sciences program like dentistry, we learn a ton when it comes to how to take care of our patients, but we don't learn a lot about, how to be effective leaders and how to run a business. And I think, going back to my initial stage of when I graduated, I think if I were to kind of be looking at what would I have known when I first started my career, it would be really focusing on, leadership, honing in those leadership skills, leadership development, and like business principles, business education, right from day one. A lot of us within our profession, we kind of don't get into that really until we're ready to say, oh, now I want to own my own practice, or now I want to start my own practice. That's when we start to really try to figure it out. But being able to like have, worked on those skills prior to all the other stuff that comes along with once you start owning your business. I think, and I would have had the time more so back then. So that's what I would have said. Hey, I wish I would have done a little bit more of that right in the beginning.
Yeah. No, I hear you. Speaking of leadership skills, is there like anything in particular that that you've kind of used regularly throughout your day or throughout your, business?
In terms of just things that I can look at to be a more effective leader.
Exactly.
I throughout all my time and being a dentist and a business owner, I'm always constantly doing things. I have a passion to learn and grow more. Yeah. So I'm always reading and listening to things and so on. And so leadership development, how to really create a team and a culture and everything that we really want. Is something that's always been kind of top of mind for me and something I'm interested in. Okay. In terms of, I'd say more, something that I've learned more recently that I think has been a big foundation to leadership for me has been emotional intelligence. Yeah. So that's, it's a big buzzword that we hear in the business world today, but that really turned the light bulb on in my head to say, well, this to me really is the foundation of leadership because of what it teaches in terms of self-awareness, self-management, social awareness, social management, like how we have to be aware of ourselves as a leader first and how we can then be aware of our team in those aspects, and then be able to put on different hats. So situational leadership's another big thing too, is I think the traditional method of leadership is always about we find one way that we think works well and we kind of go with it, but being able to put on different hats for every different situation with different team members and know when to provide the type of leadership or guidance or coaching that particular individual needs through a situation is, I think, something I'm really focusing on, really trying to work on now, because I think that's what I feel is a huge key to being an effective leader. So
absolutely. I totally agree. That's really awesome. Kind of stepping back again, you already mentioned kind of the 2013 flood, but what was some big failure or challenge that you kind of learned from throughout your journey?
Yeah, the flood would have been the big thing. So we bought our clinic and take on a lot of risk and liability, and then all of a sudden a year later we unfortunately lost our whole clinic too.
Wow.
So it was that was a big surprise, and it really forced us to learn quick. I was really fortunate that I was doing it with my brother and my wife, so I wasn't alone. Yeah. But we had to learn a lot of things very, very quickly, because you're going from literally having an operating business one day, and of course, as us taking care of our patients, there's needs that they require to be met and some that can't wait. Mm-hmm. So patients who are in pain or have concerns that need to be addressed right away. So we had to learn a lot about what do we do to keep the business going, how do we deal with insurance, how do we deal with HR issues, and the whole legal aspect around HR when it came to the flood, because it's like we kind of had a place of work to employ people, and the next day we didn't have a place of work to employ people anymore. Right. So we had to do a lot there, and essentially to learn those things very quickly, made some right decisions and some decisions that looking back we would have done completely differently. But we did the best we could, and we tried to do the best we could to take care of our people and our patients. And we're fortunate we had colleagues who kind of gave us some space within their clinics. We transported our server essentially to other clinics that held like our patient data, and we were able to luckily retain all our patient records, so those didn't get destroyed. And we were able to get them kind of out of the clinic prior to everything kind of getting flooded in that sense. So I think just there, like, it was just a lot that we went from essentially acquiring a business to almost having a semi startup. at the same time, because it took us from June 2013 almost till March 2014 before we were actually back in our space again.
Oh wow.
So we had to set up a temporary location, figure out how to make sure that we had the team to be able to take care of these patients. Again, being that many of our patients were from the area too, they were largely quite understanding, right, because unfortunately a lot of them had been affected by it as well too. But yeah, I think, from it all, hard work and just not giving up was the big thing, because there's a lot of days where you're just ready to throw in the towel and you don't know what's going to happen and you have no idea what to do, and you're also like, well, what did I get myself into? Yeah. Right? Because if we were just working for somebody, you would just go find another job, right? Exactly. So but there's a lot of benefits, I think, to it too, because seeing how we came out of it and the silver lining to it all in the end with what we learned, and we're forced to learn, but we had to go through a lot of things that maybe some dentists wouldn't even have touched on in their entire career, right? So so that really started us also on the process of my real journey in terms of educating myself on how to run a business. So that was the start of it there, because once we rebuilt our existing clinic, we had our initial investment from when we acquired the existing clinic, and then the additional dollars we had to spend to rebuild it. So we were in a position where we're like, we really got to hit the ground running, and we need to ensure that this business is viable, successful, and profitable, because we have a lot on the line now. Right. And so, I myself and my brother had joined something called Tech Canada at that time. It was a business coaching development group here in Calgary, and we're still a part of it till today, which was instrumental in really helping me look at business and any business from the basic principles of what any business shares, right? And I think we get stuck in our own kind of industry, in our own profession, thinking, well, how can somebody else tell me how to run my business when they don't know what I'm dealing with or my clients' problems are and that kind of thing. But it opened my eyes up to really be like, every business has got the same fundamentals. So how to ensure and understand and create the systems and the processes around making sure that those fundamentals are taken care of, so you can have a successful, viable business going forward. So yeah. Awesome.
Yeah, just that resiliency, that's a year into having a flood. That's that'll be tough. But yeah, like you said, just have to kind of keep moving, keep, I guess, trucking along. Don't throw the towel in. Just keep working your way through it. So that's really interesting that you went through that.
Yeah, I know. Looking back, it was a very stressful time. Learned a lot. So I feel like I always have to find what did I learn and take from any issue or challenge or anything that comes in life. Not that I want to go through it again.
Yeah. Keep that in the past.
Yeah, exactly.
Yeah, no kidding. All right, cool. So what, I guess you kind of already touched on this as well, but what kind of advice would you give someone wanting to pursue a career similar to yours, like dentistry or opening up their own practice?
Yeah. So, after 13 years now in practice, gone through lots of ups and lots of challenges and downs and things like that. And I think one of the things that really came to light for me over the past year was, I think it's so important for you to know what is your own personal why and your own personal purpose behind what you're going to do, and what's going to get you up in the morning. Because when you go through these ups and downs, it's great when you're going through the ups, but sometimes when you're going through those downs or those challenging times, if you know what is that light at the end of the tunnel for you and what is it that's really your beacon that you're going towards, I feel like that's what's going to keep you always moving forward and make sure that you don't give up, right? And so, when I kind of embarked on my own personal exploration around that and trying to see, well, what is it for me? I think a lot of times too, people want to have this larger purpose and then try to also find a career or something that fits that. And what I've kind of learned is that we're all blessed with some skill set, right? Like, hey, I'm a dentist. You're the marketing guru, right? So we all have a skill set, and it's not always about finding that career that's going to give you your purpose or why, but finding out what is your personal driver and then taking your skill set and just aligning the two. Because, again, what can you do with the skills that you have and the experiences that you have, and align that alongside with your actual own personal vision. So, for me, what, I've kind of come up with my little statement, you can see in my office here, is inspire, influence, educate. And that's, something that I came up, over the past year, that I'm like, everything that I do going forward, I want it to be something that involves, inspire, to influence, or educate. And that's a big part of what I'm doing, whether it's with my patients, whether it's with my team, or anything that I'm looking to do to impact the larger community around me as well too.
Well, I feel like you're doing all three with this podcast or audience, so that's always a good good thing. Awesome, I appreciate that. So, again, what type of unique skills has helped you personally become successful? I know you said resilience and having that beacon of light that you strive towards, but what's kind of a unique skill you'd say that led you to?
Yeah, I think persistence, drive, determination. Like, that's been the big thing for me. I was brought up with my dad always telling me, hey, anything you put your mind to, you can get there, you can do it. If you just keep focused and you keep on working to it, you will achieve your goal, you will achieve your dream, and to just truly never give up. And so I think that's something that is, a big, I'd say, skill of mine, is that if I set a goal, I will keep working towards it, and I'll keep working towards it, and I'll keep working towards it. And, even during the tough times. And, I think, as life goes on, I've learned, sometimes you have to adapt or, allow that goal to mold itself as it goes too, and be, flexible with it, but, keep working towards what you're going to get. And I think that persistence and that drive is what's kept me going always through whatever has come up.
Yeah, for sure. No, that's always important to have, especially when you're running your own business, because obviously lots of, like I always like to say, there's always macro and micro failures along the way, so you just have to kind of get through those.
Absolutely.
So what was kind of the best resources that have helped you along the way? I know you mentioned tech, but has there been any other kind of mentors or resources?
Yeah, absolutely. When I look back throughout my life, I think the largest resource for me has always been people. And I do feel that people come into our lives for a reason. And if I look back through anything, even if it was like in my childhood years, I used to be so passionate about soccer, and that was like my sport. And I had a coach that I still remember to this day, who the amount of time he put in and what he did for me. So he was there in my life at that time. When I was in dental school, I had mentors and people who really helped me drive forward with things that I wanted to do. Through dental school, I had also actually started up a free charity clinic in Edmonton called the Shine Dental Clinic. So I was the founder of the dental portion of it. It was an interdisciplinary clinic there. And as a student in my second year, I was the founding dental student, and say, well, how am I going to start this clinic, and where am I going to find money, and how am I going to make this happen? And I had a mentor through dental school who just said, you know what, you just keep working towards this vision, and I will help you figure out everything else, right? And then, in my residency, same thing, a mentor there. And, when I get out of school, I've, worked with some amazing practitioners as well too, and amazing coaches and stuff to this day that they all are there to really guide me, and I think keep me going in the direction that I want to go in. So
cool. I mean, we're in your home office. I see lots of books and good literature, but what have you read or listened to recently that's inspired you?
Yeah, so I do have a passion for constant learning, and as you can see, there's lots of books. Some that you probably don't want to see because they're pictures of teeth.
maybe next time.
Yeah. But the books that I've been really reading in this past little while that I'd say really inspired me. So one goes back to the emotional intelligence piece that I was telling you before. So it's a book called Primal Leadership by Daniel Goleman, and it's been, again, that was an eye-opener for me to really tie in the aspects of emotional intelligence and how that really resonated with me, to be able to say, I think this is a good foundation for me to always go back to continue to strive to be the best leader that I can be. From a business perspective, I think one of the books that I've been this one listening to is called Clockwork by Michael Michalowicz. He's the same author who wrote Profit First, so he's an excellent speaker on just again how to as business owners and entrepreneurs, we have a passion for what we do, and I think at some point we all kind of get stuck in this dilemma of like, how do we get from being in the business to being on the business and really drive the business growth to the direction that we want to go in. So that book has been a really cool foundation for me there. And then on a personal level, I don't know if I should say this word on your podcast, but a book called Let That Shit Go by Nina Burwell, and that was a huge personal kind of inspiration book for me. So just about just mindfulness and what we get caught up in our life, and what really kind of is our purpose, and what how do we live to be the best me that I can be, right? So yeah, so those are that kind of come top of mind to me right now.
Awesome. I appreciate that. I definitely have to check those out. I guess stepping back into your career and your industry, dentistry, what is one common myth about your profession or industry that you want to kind of debunk or put to bed?
I think the big one there for me is that a lot of people think of going to the dentist as an unpleasant and painful experience, and it doesn't have to be that way. And so for me, it is really about progressive, integrative, preventative healthcare, and that's my mantra in terms of what I follow with everything that I deal with my patients every day. And we're fortunate with the technology and the privileges that we're afforded as healthcare practitioners today, that I'm able to provide a service such as sedation dentistry on my patients, so I can take those patients that otherwise would neglect their oral health otherwise, and give them an option to be able to say, like, let's just open the door to allow you to be able to get the necessary care that you need. From a just overall patient care perspective, we're in a very unique position as dentists, because a lot of time you see your dentist more often than you see your family doc, right? And so you're seeing your dentist hopefully a couple times a year. And so being involved in being able to, when I say integrative preventative healthcare, it's about, we have the opportunity to be able to assess and screen patients for a lot of things that they might not have been aware of otherwise. So one of the big aspects that I've gotten into over the past year, also in terms of clinical treatment, is screening and treatment for obstructive sleep apnea. So that's a huge area for us. We see a lot of signs in patients' mouths that they could be having difficulty sleeping, and the health considerations that untreated obstructive sleep apnea has on patients is huge in terms of their longevity of their life, and issues with heart disease later, stroke, so on and so on. So to be involved in, again, that aspect where I can just say, hey, we're able to screen you for it, we're able to help you and treat it, but even if you don't want treatment from us, hey, at least I've helped you and hopefully made a bigger impact on your overall life. So there's more to us as a dentist than just fixing a toothache.
Right. So yes, a holistic approach.
Yeah, exactly.
That's awesome. Okay, so what are you curious about right now? It could be professionally, it could be personally, but what has kind of your attention right now?
My attention, a big thing that's gotten to my attention today is, what can I do to give back to the larger community? And I've always had this kind of inner desire of being involved in something to give back to, whether that's just the larger community as a whole, the dental community, that kind of thing. And I think that's why I've always had things where I was involved in setting up the Shine Clinic. I was on the board for the Alberta Dental Society of Anesthesiology for the past 10 years, to be able to help guide and provide access to care for patients when it comes to sedation dentistry, things like that. And then when I talk about the education piece, we've set up our educational side of what we do with our business as well, called Dent Talks, which is about bringing like-minded dentists in the community together to say, hey, how can we work together and share our experiences to be able to help drive clinical care for our patients and also growth in our business. So just looking at all of that alone, all of that together, just about for me, it's about how can I make a dent really on the world around me. And that's what I want to be able to show to my kids and things, and for them to be able to see, like, again, there's more to just the day-to-day grind. And what can I do to make a bigger impact?
For sure, yeah.
So,
be that positive influence.
Yeah.
That's inspiring. So I guess you've been operating since 2012, you said. How has Calgary changed when you first started to now?
It's changed a lot. So I started at a time when oil was $140, and here we are today, right? Seen a lot again in terms of how the economic factors and the political factors, I think, have changed in Calgary just throughout my career. It became more real to me, especially when I started working, right? What that changed for me, I guess, within my industry was that it created a much higher importance on pricing for value and making sure that we're providing true value for our patients, because though I said before we're in a healthcare industry, people are always going to need us, there's still aspects to our care that are discretionary as well too, and people are going to choose whether they want to spend money on it or not. Right. And how can I make sure that I'm creating value with everything that I do so that patients feel that this is important, and even if they can't afford it now, what am I doing to just be able to inform them and help them understand and see that again, that there is this is your overall picture and we're here to help you with that. So so I think that's the biggest change I think I've seen, is just how the economic factors and the political factors that have affected business as a whole here in the city.
Right. Yeah. Just a few more questions. This one's a little bit more tricky maybe, but what's one question that you never get asked that you wish you would be asked?
Yeah, that's a tricky one. I think, again, I think a lot of times when we're asked questions, even in an interview like today, and I'm glad you're asking a question like this, because we focus a lot on what we have done, but sometimes it's like, well, what am I doing to go forward with what I have learned up to today? Right. And that just kind of ties me back again to your other question about, what am I curious about now? And it's like, I'm really looking at, what can I take, from when I said even about what I would tell somebody who was looking to start a career today about, like, what can I take about, like, aligning now my personal purpose with the skills that I've developed over all these years when it comes to me as a dentist and me as a business owner, and driving forward, something to make a bigger impact and a bigger change. And I really see, like, where I see that and what could be a big impact area, I think, is, again, and continually driving access to preventative, comprehensive, integrative healthcare. And, as a dentist, we play one role in that. But, I think it's up to us to find innovative ways to ensure that all our patients get access to the top quality of diagnosis and planning, so that they're able to have the choice and have the education to understand that, okay, this is my bigger long-term picture and what can I do, and have us as a provider be able to support them to get there. So yeah. I don't know if I totally answered your question there.
No, that was great. Okay. Yeah, for sure. Awesome. Well, again, really excited to have you on the podcast. Where can our listeners connect with you online?
Yeah, absolutely. So to connect with me personally, I'm on LinkedIn, so you can look me up on LinkedIn there. I know you'll have the spelling of my name and everything on your link. Also, my email address too. I'm happy to leave that here on the podcast as well. So it's akhanna@midtowndentalcalgary.com. And then, of course, at both of my clinics, so 9th Avenue Dental. So,
awesome. Yeah. Again, really appreciate you, Amreesh. One thing we like to do on the podcast is end with a question to the audience, or maybe a quote or a story for them to kind of leave them with a lasting impression of you.
Yeah, absolutely. So, again, just kind of going back to, I guess, what were my uniques and what I was saying, in terms of what I take kind of from my life. And it's cool being able to kind of even think about, how to answer some of these, because it makes you reflect a little bit upon everything that you've done. My resounding theme, again, I think, was like just to never give up, and determination, and just keep moving forward with achieving your goals and your dreams, and finding where you want to get through whatever it is that you do. So I know you're a sports buff. I'm a movie buff, so I tried to find a quote here that was kind of in the middle.
Common ground?
Yeah, exactly. So I got a quote from our famous Rocky Balboa.
Oh, nice.
Okay.
I can respect that.
Yeah. It ain't about how hard you hit. It's about how hard you can get hit and keep moving forward. And how much you can take and keep moving forward. That's how winning is done.
Wow.
So, yeah.
I can appreciate that.
That's one of my favorite from his more recent movie of his. Yeah.
That's awesome.
So yeah, it's again, life is gonna throw a lot of punches as for this quote here, but it's up to us, I think, to take that and either change course and step down or just find a way to keep going to where you want to be. So,
absolutely.
Yeah.
Well, thanks so much, Amreesh. I'm sure our audience is going to get lots of value from this episode. So
thank you so much, and really appreciate the opportunity to be on your podcast. And thank you very much for having me.